The pre-op report tells us the configuration for the 11mm pin, 5mm pin, and the Mackay hole. Slide the 5mm pin into the dovetail and align the markings. Repeat this process with the 11mm pin. Secure each pin in place by tightening the thumb screw. Measure and mark the predetermined position of the proximal offset pin on the bone. Insert a 2.5mm single trocar pin into the proximal hole and place the guide on the bone. Identify the Mackay hole and drill using a 2.5mm bit. Leave the bit in place. Ensure the offset pins are in contact with the bone and insert a 2mm bit into the oblique locking hole and drill bicortically. Leave the bit in place. Perform the osteotomy using a sagittal saw. Ensure that the blade remains parallel with the saw slot at all times. Next, remove the oblique locking bit. Followed by the Mackay bit. The guide can now be removed from the bone. Compress the bone hinge with pointed reduction forceps. Open the osteotomy with a periosteal elevator. Insert the corresponding advancement lever. Ensure it is 3 mils distal to the proximal aspect of the osteotomy. Slowly advance the crest. This should be done over the span of about 2 minutes. Once complete, ensure the advancement lever is flush with the proximal aspect of the osteotomy. Insert the wedge implant immediately distal to the advancement lever, which can now be removed. Contour the plate by using the plate bending recesses of the advancement levers. Match the shape to the contour of the bone. Replace the pointed reduction forceps to compress the construct. Place the plate on the bone according to the pre-op plan. Ensure the proximal screws are centered on the crest and distal to the patellar tendon insertion. Ensure the distal screws are centered on the diaphysis. Drill and screw the proximal most screw first, followed by the most distal. Then place the remaining screws. Remove forceps and assess wedge and plate placement.